Welcome parents and kids. Today we'll be talking to you about otitis media, which is just a big fancy word for ear infection, which is something that is common for children. We'll talk to you about what an ear infection is, and we'll also talk to you about what your treatment options are and what are the best ones for you. And so today, my name is Vic.
And my name is Macarius.
My name is Tyler.
My name is Hibbs.
Lindy.
Eric.
And we'll be bringing you a lot of educational info.
Otitis media is a middle ear infection. It is caused when fluid gets stuck behind the eardrum. It is very common, especially in children. More than 80% of children before the age of 3 years old have had otitis media. It is more common in infants specifically because their eustachian tube is horizontal instead of a 45-degree angle. So as your child grows, it will become a 45-degree angle, thus decreasing their risk of otitis media. So ways that chiropractic care can help otitis media is by reducing tension, allowing the ear tube to function properly, and helping your nervous system communicate properly. Chiropractic care for otitis media is also very cost effective and a very safe treatment. It has also been known to prevent otitis media. It has been shown that children that have seen a chiropractor regularly have had much less otitis media than children that have seen medical doctors regularly.
An ear infection, it is also called otitis media. It's an infection of the middle ear in the air filled behind the eardrum that contain the tiny vibration bone, and it's more common in children than adults to get a middle ear infection. It is when the air filled space in the middle ear, it's unable to drain the fluid and become blocked and start to build up negative pressure that lead to the growth of the bacteria and foreign material, leading to infection.
So here we have a model of the adult ear. Just a general overview of it. You have the external ear, which goes all the way in through the ear tube to the tympanic membrane, which is this circular structure here. Then you have your middle ear, which is the area that the ear infection happens in. Then you have your inner ear. In the middle ear, you have the eustachian tube. You can see through here, this connects to your nasopharynx, which is part of the oral cavity or your mouth. This is the main cause of why you get an ear infection, especially in kids. So you can see how in an adult it is angled downward. And just with general gravity, it's easier for fluid to drain through this eustachian tube into that oral cavity. But this is different when you have a developing child. So in a child, instead of it being down like this, it's going to be more horizontal. This makes it easier for the fluid that's built up in this space to become blocked, causing swelling and, like Max said, a bacterial growth in this area. A lot of times, so here's a diagram of what it would look like. So you can see the swelling and the fluid accumulation in the middle ear. But a lot of times in children, it's not easy to recognize the symptoms as if they're young enough, they're not able to verbalize that they are in pain. So some things to look out for is irritability, trouble sleeping, tugging at the ears, hearing loss, and loss of balance.
So let's talk about your treatment options when it comes to ear infection. As in any situation medically, we should always look to work from the most conservative option to the most invasive option. And it's the same case when it comes to ear infections. So on the conservative side, we have time and those things, and on the most invasive side, we have antibiotics and surgery. If you go to your doctor, hopefully they'll tell you that the most effective option is to give the body time. That is because most ear infections clear up on their own. It is only in the very extreme cases that you should look to antibiotics or surgery for those things. And the reason they do that is because antibiotics and surgery have complications. So let's start with antibiotics and let's talk about what those complications are. So antibiotics, they come with the risk of antibiotic resistance, which is basically where your body builds up a resistance to antibiotics. And in that case, if you were able to take more antibiotics, you basically, the antibiotics would have no effect because you've killed off all the bacteria that could be killed by the antibiotics, and all that's left are these resistant bacteria that are then able to lead to more serious complications. You also kill all your gut bacteria, and that's a very important thing when it comes to immunity, when it comes to digestion. That is a super important thing when it comes to things like digestion, and we want to be able to have regular bowel movements and all the different things so we can also absorb nutrients and all the great things about digestion. Also, you impair your immunity when you take antibiotics. So part of being a healthy living organism is to have a good balance of bacteria in your body. And so when you don't have a balance of good bacteria, you actually don't have the ability to fight infections as you normally could and should. So for that reason, when you start taking antibiotics, you are actually impairing your ability to be able to handle different types of infection. Now let's move on to ear tubes, which is the surgery side of treatment for ear infections. Ear tubes run a big risk of you actually developing hearing loss because the placement of the tubes can impact the eardrum, which can impact your hearing. Ear tubes can also lead to actually perforating the eardrum, which is a fancy way of saying you can blow your eardrum, which is not a fun thing. It's a very painful thing. Eardrums can heal, but that also can lead to infection down the road, which is another complication of getting ear tubes. The last thing that ear tubes can cause is calcification of the actual ear, which, amongst other things, can also be a cause of how you get hearing loss as well. So all in all, your best options, and like I said, the APA recommends it as well, is just to give ear infections time, right? And so in most cases, with children, you're gonna see the ear infections clear up, and your body's gonna build an immunity up to the ear infection itself so that you don't have recurrent ones in the future.
As Vic was saying, the most conservative and effective way for an ear infection to be healed is just with time. But as chiropractors, we like to help, and we hate to see you worry about your children and loved ones. And we know that it can be hard to sit and wait for the infection to heal on its own. So if you would like a more conservative approach that can influence the healing process and help with the infection and drainage of those eustachian tubes, you can see your local chiropractor, and they can use a variety of safe techniques that will influence the healing process. The Muncie technique and the craniosacral technique are two common techniques that are used to help the sinuses and the eustachian tubes of your ears. The Muncie technique focuses on the fascia and muscles around your ear canal to help close the auditory tube and let that drainage flow down through your nasopharynx. The craniosacral technique focuses more on the sinuses and making sure that those are cleared out and able to be drained as well. Also, chiropractic believes that the nervous system has the power to heal your body if it is communicating properly and can send signals fluently and concurrently to everywhere it goes in your body, organs, arms, legs, eyes, and especially the ears, because they're attached to where your nervous system is kept, your brain and spinal cord. And if you have any misalignments in your upper cervicals, it can cause a miscommunication of those neurons to the ear and delay the healing process. So if you go see your local chiropractor and you feel safe in their hands, we hope that we can help your child heal quicker from their middle ear infection.
So here's the better methods to help the kids get rid or prevent the disease better than waiting to see the symptom of the otitis media. So it's a little bit too late to care for children when we see the symptom of the otitis media, because children don't aware from what the otitis media look like and what is gonna make their body feel like. So they don't know about that. So they all based on the parent. So parent are the one who help the children to prevent and get the better health to get rid of the otitis media. That's the Muncie technique and craniosacral technique. That's the best techniques that can help the children prevent and get a better health in the future. So parents, take action. Don't just waiting. Bring your children to chiropractic care for like often to be checked up and care for the future generation. Thank you.
Thank you for listening to our presentation. We hope you learned a little bit about a middle ear infection, what causes it, and what your options are for treatment. Thank you.